any blood, any white, chalky color, or just completely jet black after the fourth after the fourth day, you should be a little concerned. But if you do see like yellow or like little seeds, that is totally normal for a newborn. Let's see. When you go to bathe your newborn, um, you are only going to want to do that right now 2 to 3 times a week because the umbilical cord is still on. It is cut, it is clamped, it is going to dry off, and it's going to fall off in about 1 to 3 weeks. You're going to try to avoid covering that umbilical cord or saturating it with any soapy water or anything like that while giving the bath. You want to use a mild soap while giving the bath. Just be mindful that your newborn may or may not be sensitive to those detergents. So if a rash appears, just make sure you notify your healthcare provider. With that being said, newborns tend to get what they call baby acne. They're like little white bumps and they'll be all over. Do not try to pop or squeeze them, as tempting as it may be. Just try to avoid that and it'll be fine. Whenever you are cleaning and bathing a newborn after a circumcision, you'll want to make sure that you clean that area completely, like as good as you can. That prevents any infection. That foreskin was taken off and there's going to be like a little plastic ring around there. You want to just make sure that you clean as well as you can. You do not want to use any soaps or baby wipes because it can irritate that, since there was some cutting and messing with that area. It could just be really, really sensitive right now, so you do not want to do that. Let's see. After you're bathing, and then say you want to lay your baby down first to sleep, the baby adjusts to what life is like. If you want to go have your baby sleep on a certain schedule, I would advise that you start that sooner rather than later. It will help. You want to make sure that the baby is not sleeping with anyone or with anything. You don't want to place your newborn on their stomach. You want them on their back. You want them on their back to prevent any harm or suffocation. SIDS is a big part of that. Sudden infant death syndrome. Sometimes it can have no cause and it can happen at any moment. You want to make sure that their airway is free of any obstacles, so that's like, again, removing any blankets, any toys, any things that you might think that the baby needs at this moment. They probably do not. Newborn infants usually typically sleep about 16 to 20 hours in a day. So Mom, you need to try to sleep as often as you can. I understand that may not be what you want to do. You may want to go clean. You may want to go fold that laundry. Try to take a nap so that way you're feeling a little bit more refreshed instead of drained physically and mentally from lack of sleep. Whenever your baby is crying and overwhelming, and again the lack of sleep, there is the possibility that you think, or not you, but you may feel the need to shake your baby so that way they'll stop crying. That will not make your baby stop crying. That will actually harm your baby. Do not shake your infant. Do not. If you feel like you are overwhelmed or stressed, please call for help. Ask someone to help you. Get some rest. Again, try to sleep when the baby's sleeping so you don't have those types of feelings. Not saying that you won't, not saying that you will. Just make sure that you rely on other people for help if you feel the need to harm your baby or think that shaking or any kind of movement aggressively would help calm your baby down. It will not. Things to notice on your baby. Jaundice is a common thing in infants and newborns. Um, if you are getting concerned about that, just make sure you notify your healthcare physician. You can go in and the bilirubin levels can be checked in the office. Um, there's some things that you need to remember whenever taking your newborn home that you need to watch for. Um, One, first, it is not required to take temperatures. You're not required. You don't think you need to. You don't have to. However, if you do feel like your infant has a fever, you would want to try to take it underneath the armpits or in the rectum. Most physicians prefer that way. It's more accurate. It's their internal body temp. Um, doesn't really hurt them. It's startling, but they're babies. Um, the newborns are sensitive to the changes as far as cold and hot, so be cautious of that. Make sure if it's cold, you want to make sure that they're wrapped up in warm clothes. If it's hot outside, you don't want to put too many clothes on them. So, signs and symptoms for infections that you might pay attention to is a temperature greater than 100.4 or of 100.4 or 100.4, a temperature lower than 97.5. Let's see, excessive vomiting or blood in the vomit, less than 6 wet diapers in 24 hours. You want to make sure that they're filtering all those nutrients out, making sure they're getting what they need. If they have a swollen stomach and they haven't pooped for 2 days, 48 hours, you need to make sure you're paying attention to those, documenting them because your physician may ask. If they have a cough, or a runny nose, yes, they're getting used to what's going on. However, you don't want them to have mucus and drainage and it get into their lungs and can cause like RSV, pneumonia, things like that. Thrush in the mouth. Obviously, newborns don't have teeth, so you want to make sure that their mouth is free of any excess of milk, anything like that may cause irritants in there. That's yeast. You don't want that. You just want to make sure that your infant is clean, doesn't have all that drainage and stuff. It will just help because it can be painful. You always want to make sure that their airways are clear, so if they are having excess of mucus and stuff like that, you can use the little blue syringe bowl thing and squeeze out any extra mucus out of their nose, in their little cheeks. Again, it's not really harmful. It will just startle them. It might, be loud. We'll get it out. You have to make sure that your car seat is installed properly. You want to make sure that your infant is rear facing. No, we don't need to turn our baby around so that way we can see them. We want to have them rear facing for safety reasons. If you need to, buy a little mirror and you can see. Once you can drive, or have someone drive for you and you sit in the back seat with your infant. If you're unable to properly install that, you would want to seek help. I know the fire departments usually are really good about that, getting them in there tight and snug. Your infant should have a follow-up appointment within 4 days after discharge. Start making any notes, concerns, comments that you may have, things at work that you don't know, or things that aren't working that you might need help with, so that way you can ask at your appointment. Let's see, if you have any additional questions, I'm here to help and answer those for you. I can, if I don't know, I can find out. But as far as this goes, I hope that you guys are successful and you have a happy home life, and congratulations on your baby. Thank you.